important. What is golden hour in road traffic accidents? So my first question that I want to ask to you is, have you seen a surge in number of cases coming after road traffic accidents in hospitals recently, like in recent years?
Yes, definitely there is a surge. If you go by the statistics of Pune RTO, that is Pune City Police, then as of now, we have about 3 deaths occurring as a result of road accidents every single day, and 3 to 4 major accidents and many more minor accidents. And these are the reported ones. And I'm talking of Pune City alone. So if
Right.
the RTO statistics of Pune City alone. So I'm not including the Pune rural jurisdiction of police. So if you go by this statistics, that's quite alarming. That's about 2 to 3 deaths every day and 3 to 4 major accidents per day.
Very
And
true.
of course, I must add this that this was pre-lockdown era.
Right.
Since
Right.
the lockdown has begun, this number has drastically fallen because obviously the roads are empty. But then
Right.
before the lockdown, this was the statistics. So
Right.
definitely there is a surge. And what I must add here as well is this uh, age group of patients which are involved in this major accidents are usually 20 to 50. So they are the most productive population of our country. They are the breadwinners of any family. And alarmingly, these numbers are rising.
Right. Right. Uh, So when an accident happens, there sure is a physical trauma, and then there is a mental trauma. People are overwhelmed, they don't know what to do. And then there are a lot of bystanders, they come together and they start giving advices. So it's a chaos in India whenever there is a road traffic accident. As a person, individually, if I'm traveling somewhere or if I'm commuting, I have an accident. What things should I keep in mind to do in case I am involved in a crash?
So if you are involved in a crash yourself,
Right,
then the first thing that, and you are conscious enough to understand and grasp what is happening,
right,
the first thing that you should do is not panic.
right,
There is a lot of mental trauma associated with it. And the first reaction usually is panic or fear.
right,
Now, I completely understand this reaction, and this is a very, very natural reaction. But then you need to keep your head cool and uh, try to dial an ambulance number,
right.
because we now have a very good EMS system, an emergency medical service all across the country. By dialing just 108, you get a nationwide ambulance service, and they are rather fast. The ambulances are good. They have a doctor on it. And though now they are busy with COVID patients,
Right.
otherwise they do cater to accident victims. And that is your surest way of getting to a trauma center
Right.
or a nearest hospital. Now, you must have also alternatively a couple of other emergency ambulance numbers with you.
Right.
So if that does not, one does not work, then the other might. So you must have emergency numbers handy, and you should be able to dial those if you are involved in one accident. Unfortunately, if you happen to be involved in an accident.
Right.
If you're a bystander, then also you don't need to panic. You don't need to worry. You need to again dial one of these ambulance numbers, and they'll come there and do the rest. They have trained emergency medical responders who are trained to handle
True.
accidents and emergencies.
True.
Now, what unfortunately happens is a very wrong trend of bystanders just clicking photographs or
True.
taking video. Instead of wasting time on that or doing that, what one should do is first dial an ambulance. Maybe by the time that ambulance comes, you can do rest of the things. But then the first thing that you should do is dial an ambulance
Very true.
and see to it that it reaches as soon as possible. Because I'll quickly tell you in a minute that there is this concept called as the golden hour.
Right.
So the very first hour, what is a golden hour? The very first hour after any accident or any trauma,
Right.
physical trauma,
Right.
it's called as the golden hour. And
Right.
in that also you have the first 10 minutes as the platinum 10 minutes. Now,
Right.
why is this? Uh, this hour is called as the golden hour because after this very first hour, there begins a cascade of reactions in the human body after any
Right.
major trauma,
Right.
which serially starts a cascade of deterioration.
Right.
There are certain changes which begin inside the human body, which make the patient worse. So, if the
Right.
patient gets expert medical help within that very first hour, then not only his chances of survival increase, but his chances of getting back to functional recovery or the pre-fall, pre-accident status
Right.
are very, very good.
True.
So that is the importance of this golden hour. And in that also you have the first 10 minutes as platinum 10 minutes. So however bad the injury may be, if the patient is in a proper healthcare center in the first 10 minutes or at least in the very first hour, then the chances of survival and functional recovery are absolutely almost close to 100%. And that is why
Right.
we should hurry up. As soon as you see an accident, you should hurry up so that you don't waste that golden hour. If you
Right.
go by all the emergency medical services across the world, the average ambulance response time ranges from 3 to 10 minutes
Right.
or three
Right.
to 5 minutes across in all the developed countries that you see. So, especially in the Western world. Now, why is
Right.
that? Because they don't want to waste even those platinum 10 minutes. And that is
True.
why you have air ambulance or helicopter ambulances, or we see in movies, and you must have seen abroad that there are rapid transit systems,
True. True.
special ambulance corridors, special tracks given to ambulances.
Right.
That is to make the victim reach the hospital in the very first 10 minutes or at least in the first hour.
Right. Okay. All right. So, having ambulance arriving in first 3 to 5 minutes and a hospital being nearby that in platinum time, the patient should reach a medical facility. In an idealistic condition, this is the right way. What can we tell something to our viewers about in case the ambulance is not? It's a little remote place where there is no immediate access to the ambulance or a medical facility is a little far away. What precautions people can take if they want to transport the patient by their internet connection issue? Yes, sir. Am I audible?
Can you hear me?
Yes, I can. I can. Should I
Yeah,
repeat the
so
question?
no, I heard your question. What happens, unfortunately, in our country is that most of this golden hour is lost.
True.
The victim is lying on the road for hours together. Then somebody who is brave enough to take some initiative gives him some first aid or happens to call an ambulance. Then he's shifted to a nearby center. Now, this becomes problematic. That nearby hospital or whatever dispensary is may not be equipped enough to deal with a case like polytrauma. You have two types of you can broadly divide accidents into two categories. One is high velocity trauma, wherein you have multiply injured patients. So a patient who
Right.
is injured from head to toe, these are because of high velocity accidents which you usually see on highways. And
Right.
another category is low velocity trauma, where which you are dealing with domestic falls or simple one fracture here or one or two fractures here and there. So these two are completely different subsets of patients.
Right.
The
Right.
high velocity trauma or major trauma, polytrauma as we call it, should reach a good trauma care center within the
Right.
very first hour. Now,
Right.
by trauma care center, there is a very precise definition of what we mean by a trauma care center. So, trauma care center is a hospital where you have all the services available 24 by 7. So, you must have a round the clock working casualty department where the emergencies are attended to. You should have a 24 by 7 working operation theater. You must have a CT scan, an MRI, a 24 by 7 lab,
Right.
theater. All these facilities are available, and a team. These injuries are successfully treated by a trauma team. The trauma team consists of an orthopedic surgeon, an anesthetist, a general surgeon, a cardiac surgeon, a physician, etc. So this team should be available 24 by 7. Now,
Hmm.
not all places have this facility.
Right.
So in our country, unfortunately, what happens is that the patient is transported to the nearest place, which may not
Right.
be so equipped. Then he's
True.
shifted somewhere else. Then he's shifted to a third place. So by the time this patient reaches a good trauma center, the golden hour is already lost.
True. True.
And that is why the importance of dialing a correct ambulance, for example, the 108. Now they are trained to take such victims to the right place.
Right.
Or if you don't get this 108 or any other ambulance, then you must have numbers of such big hospitals or trauma care centers available with you. So you must transport that patient there. So that's the
Right.
first thing you can do to help the patient. As soon as possible, take him to a place
Understood.
which will cater to that patient with all these facilities available.
Right.
Now, if by the time this ambulance comes, what the bystanders can do is give some first aid. Now, first aid involves two, three things. One is the first principle is not to do further damage to an already injured patient.
True. True.
Make the patient comfortable in terms of pain and um, whatever the trauma is, at least make that limb or extremity stable enough to be transported. So there are simple things that you can do in first aid, like in the upper limb, if the hands are involved, then you can give a simple sling made out of a dupatta or a bandage. If the patient is injured in the lower limbs, you try to make him horizontal. If the patient is unconscious, then you try to turn him on the sides. You
Right.
see any major, if you see any major bleeding points, then you can just try to stop the bleeding by giving pressure. So if you have a clean piece of cloth or handkerchief, then you just give pressure over the bleeding area and hold that pressure for about 10 minutes by clock, and
Right.
almost all bleeding would stop within those 10 minutes. So there's no need to do anything heroic. Try to stop the bleeding, try to make the patient comfortable, try to alleviate his pain, and get to the hospital as soon as possible.
Right. Thank you so much for answering that. So now, are there any physical signs of understanding if this is a major trauma or minor trauma? So in case like extra precaution should be taken, or as you mentioned, a better setup, or a patient should be taken to a bigger and well-equipped facility. Are there any physical signs of this to confirm that this is a severe case and should be treated differently?
Yeah, so a patient who is obviously unconscious or unresponsive, so he is not able to open his eyes or not talking, not responding even to pain, is obviously critical. And
Right.
so before I answer that question, let me tell you that whenever we are dealing with polytrauma, there are about three peaks of death, as we call it. The first
Okay.
peak of death is within seconds. So what we call as death on spot. Now, this is
Right.
a supra major injury to either the brain or to major blood vessels, and that is something which nobody can prevent. So that is, unmanageable. The
Right.
second peak is within the next 6 hours. So we are trying to treat those patients so that they survive. And the third peak is after a few weeks. Now, this second peak is what we are looking at. Now,
Right.
most of these patients, the serious patients, can be identified like this. So they're breathing, but they're not responding. So they are not opening their eyes.
Like you said,
In
no response to pain can be a big
Yes,
identifier. Right.
that's a big identifier. Any major source of bleeding anywhere, that is a serious injury. Then any injury in the central axis of the body.
Right.
Now, all the central injuries, like the head injury, the neck, or the chest, or the abdomen, or pelvis, so in the central axis of the human body, these are fatal injuries.
Right.
However, bad looking injury may be in periphery. So, even if you have a badly crushed hand or leg, or a fractured, deformed, mangled kind of an extremity, that is an injury which is not going to kill the patient, however bad it looks. So
Right.
usually what happens is, looking at that kind of a serious injury, people are frightened. Ki this looks very bad. But
Right.
ironically, the peripheral injuries do not kill. What kills is the injuries in the central axis of the body. So if the
Right.
patient is complaining of pain anywhere in the central axis, then that is critical. That
Right.
is something which requires emergent treatment and should be transported within the first 10 minutes, ideally,
Right.
because then the chances of survival dramatically increase.
Right.
Also, the chances of functional recovery are more.
Right.
So these are the pointers which should help you. Or if the patient is vomiting profusely, so that is a sign of head injury. If the
Right.
patient is bleeding through nose, mouth, or ears, then that is again a sign of head injury. The
Right.
patient does not remember how the accident happened or where he was going, or he is confused, he is unable to tell his name or address, then that signifies a head injury. so so these are the injuries which are these are the signs which predict a serious head injury.
Right. And you have very well and simply explained that. So I guess our viewers will understand in which case more attention or quicker response is required.
Yeah, so if he's having, say, breathlessness or pain in
Hmm.
the chest or severe pain in the abdomen, then
Right.
those are the pointers of serious injuries.
Right. Right. Uh, so my next question, sir, is doing first aid or what to do right takes years of learning, or you need to do some training for that. But can you guide us with what not to do to worsen the condition?
Yeah, so simple things now. Common tendencies after uh, one gets involved in an accident or tries to help an accident victim, uh, there can be some uh, disastrous situations, like, there is a common tendency to try and give water to the patient. So if the
Right.
patient is conscious enough, the bystanders bring water and try to make him drink water or eat something. So that is to be avoided, because you never know what intervention is required. And if the patient has had a glass of water or something else, then one has to wait for another 2 to 3 hours to give him anesthesia.
Right.
So the patient needs to be empty stomach. There's no need to feed the patient anything or even
Right.
drinking water. There is One should avoid the tendency to correct any deformities of the limb seen or attempt to massage, or because that massage can lead to some dangerous consequences later on. Attempting to reduce dislocations. Now, I have seen so many times shoulder dislocations or elbow dislocations, bystanders trying to reduce them on road. So trying
Right.
to undo a deformity. Now, this should not be done unless you have taken an X-ray, because there may be a fracture associated which is worsened by these
True.
attempts. In
True.
the lower limb, what is commonly told is to get up and try to stand and walk. Now,
Right.
if there is a minor fracture, because of the weight being given on that fracture, the fracture can become a complete or a major fracture. So these
True.
tendencies should be avoided.
Right.
So many times I also see that if there is a bleeding point, then some tourniquets are tied above that bleeding source. Now,
Right.
one should not do that. The bleeding can immediately stop by giving just pressure with a sterile or a clean cloth for 10 minutes. There's no
Right.
need to tie anything above or below the bleeding point. There's no
Right.
need to massage anything. There's no need to correct any deformities. And certainly do not feed the patient.
Right. All right. Thank you so much, sir, for answering that. Now we're almost coming to the end of our conversation. So, our viewers, if you have any questions, you can start posting them in the comments, and Dr. Pradhan will answer all related questions. My next question is how, like you said, giving water to a patient can turn out to be bad, and the procedures that are going to be done later will have to be delayed because of that. So, what kind of information bystanders or the first responders should give to a medical professional once they approach the patient? Is that information, that history important?
Yeah, so medical professionals usually do not grill the bystanders much.
Right.
Um And what is a common tendency or a common fear is that if I help an accident victim, the police will harass me, or
True.
the blame will come on me. The police will say you only caused the injury. Nothing of that sort happens nowadays, because there is a clear-cut law which says that the bystander who helps the accident victim should not be troubled. There is
Right.
another law uh, by the government that no hospital can actually refuse emergency treatment to any accident victim, irrespective of anything. his payment
Right.
status, or nothing at all can defer emergency medical treatment to any patient walking into a hospital. So, with these two laws in place, the bystanders need not worry. They can straight away rush that patient to the hospital and give basic information like how they found him, whether he was conscious, responding or not,
Right.
whether he was obviously bleeding from somewhere, what did he complain of on the way. So
Right.
these are the two, three things that they can tell the attending doctor, and these are the only questions that we ask the bystanders. Okay, how did you find him? Was he conscious or unconscious? Was he bleeding from anywhere? And what did he complain of when he was on his way to the hospital? Rest of the
Right.
things we take over. Very often we don't even mention the names of the bystanders. They can very well remain anonymous. They can
Right.
deny disclosing their identity. That is their right, and just walk off once the patient is handed over to the medical team. There is
Right.
no way that anybody can harass a bystander by law, not even the
True.
police. The police also nowadays are very sympathetic. They are very helpful. I have seen police help so many accident victims in a big way, and
True.
so there's no need to worry or fear. This is this fear factor which prevents most of the bystanders from helping the accident
Helping. True.
victims, and we lose a very important golden period because of this fear psychology. So that's something which we all should shed immediately. If you see an
Right.
accident victim, out of humanity, help him get to a hospital. Rest of the things will be taken over by the hospital team, by the emergency team there, and you can just
Right.
walk off and feel happy about helping that patient.
Yeah, for sure. For sure. You've really put it very well, sir. We have a question by Sujit. Sujit is asking, what if anyone doesn't find ambulance on immediate basis? Can accident victim be transported by public transport?
Yes, very much. If ambulance is not available or takes a long time to come, whatever transport available can you can transport the victim to the in the nearest hospital or any medical facility that is available. But if you think that this is going to be a serious accident, or if you think like I told you a few pointers, if you identify that this is going to be something big, then you better shift him to a bigger hospital, because only then he will receive the treatment which he deserves in the first golden hour.
Right, right. So I personally have one question that I wanted to ask. A lot of
Yeah.
times, patient is taken to a local clinic or somewhere where a cast is put, and a lot of times the reduction is not done properly. They haven't seen the X-ray clearly, and a cast is put, and there are chances of malalignments. So, what are your thoughts on that?
Now, as an orthopedic surgeon, nobody would like to malalign a fracture. And
Right,
today, even in small peripheral setups, we do have equipment like an image intensifier or a live X-ray, which will
right,
tell you intraoperatively whether the alignment is good or not. So, as a surgeon, I would say that I would try. Any orthopedic surgeon would try his level best to align. But if he's unable to do so, then he should shift him to a higher center where expertise to open it up and align properly is available. So he may give a cast temporarily or a slab temporarily, which is like a splint, and then shift the
right,
patient to a higher center and see to it that the patient gets well aligned.
right,
Because
right,
now technology has progressed to such a level, and we have such wonderful techniques to treat trauma, that
right.
most of the practice, however badly the patient be injured, we have technology and methodology of treating these injuries advanced to such a level that within a few days the patient is back on his feet, and within a few months he's back to his work. Now,
Right.
you also would agree that rehab techniques have also progressed to such a level that you can immediately mobilize these patients out of the bed. They can get back to their functional status or to their work status
True.
very soon, much sooner than what we did before.
Right. Very true, sir. Thank you so much. I guess you have really well explained to what exactly golden hour is and the 10 minutes of platinum time which is there and how to identify trauma cases. We're getting one more question. Let's take that. So, is there any way to find Is there any way to find where is trauma hospital nearby? Most are confused which hospital to go. Any helpline for that? Do we have something like that available?
Yeah, there are many helplines. The hospitals themselves have their own helplines, and nowadays they have apps also. So there, every major hospital has its own app which can be accessed as an emergency basis. There are emergency buttons available. So with the click, the ambulance system in that hospital will be alerted, and you can contact such centers. So especially in major cities, most of the big hospitals have their own numbers, their apps, and they are online 24 by 7. So there's not a central helpline. The
Right.
central number is 108, but individual helplines are available from all the hospitals.
Right. And I guess for all of us, it will be a good idea that your regular route of commute or your regular route of travel, you should know the hospitals around. So in case you need to help somebody, you will be equipped with that information.
Yeah, so even if you, on any of these apps like Just Dial or anywhere, if you a
Right.
hospital nearby, if you type, you will get the shortest possible route, and you must store numbers of most of the major hospitals as emergency numbers in your mobile phone so that you can dial them and they usually take over from there.
Right. Okay, so I guess that's all the question we have. And thank you so much for giving your time and explaining in detail about what golden hour is, why it is important to transport the patient to a good facility within first hour, and also the signs to identify what is high velocity trauma or what is major trauma and treating that patient with utmost urgency. Thank you so much for giving us time to all our viewers. Thank you so much for joining us. We will be back next week with another surgeon and another perspective. Thank you
Thank
so
you,
much.
Saurabh. Thank you. It was a pleasure.
Same here, sir.